Many of the drugs prescribed to us as painkillers can become very addictive if misused. Diane from the Simcoe Muskoka District Health Unit says a lot of people don't realize how it's becoming a problem here in Muskoka.
A lot of people think, well, I'm seeing it in the news and it's BC or Toronto or Ottawa, but I think we need to be aware, absolutely, we have a problem with opioids in Muskoka as well. We are certainly not immune to this. We are a short distance from Toronto and Barrie, and drugs travel, and we know that fentanyl in particular is being manufactured illicitly in other countries and brought in across the border. Very minute amounts of fentanyl are highly addictive and can cause an overdose. So fentanyl is 100 times stronger than morphine. That's incredible. And it's being put into other drugs. So even if your child says, well, I'm only using weed, we know that it's now being laced in weed, and fentanyl is very easy to put in weed, and so it is causing a lot of problems, overdoses, etc.
Most people don't know what opioids are. As Diane says, every single one of us should be aware of what they are and how they can affect all of us.
Opioids are a class of drugs that work very effectively on acute and chronic pain. But they work not only on physical pain, but also on emotional pain and mental health issues. So they can have a very euphoric effect, and that's why a lot of people become addicted to them. It's very easy to become addicted. Some people become addicted very quickly. When I say addicted, I mean they develop a tolerance and a dependence on them where they cannot function without them.
Not only is fentanyl a concern, cocaine, morphine, and codeine are just a few to mention as well. Diane says that they're finding more and more younger people are using opioids and that they're focusing on educating the public on the dangerous use of these drugs.
We really need to get that education younger and younger to students and their parents and their caregivers to say, talk to your kids, let them know what the dangers are of opioids. A lot of the misconception around opioids for young people is that it was prescribed for grandma or my mom, so it's safe for me to use too. It's a prescription. It was prescribed by a doctor, so what's the harm? But if it's not prescribed for you and you're not taking it the way it was prescribed by the doctor, if you're taking it to get high recreationally, which I talked about the emotional, how it takes away the emotional pain and gives you that euphoria, then there's a problem, and parents need to be aware that kids are doing this. We know, according to the Ontario Student Drug Use and Health Survey that's done by the Centre for Addiction and Mental Health, we know that 1 in 10 of our grade 7 to 12 students are using opioids recreationally, non-medically. So they're getting them, 60% get them from home, so they're stealing them. And they, as I just mentioned, they think it's perfectly safe.
The health unit does provide a free naloxone kit that is a life-saving drug that is administered when someone is overdosing. This is only a temporary relief until the person can get to a hospital. For more information, you can visit simcoemuskokahealth.org. I'm Samantha Johnson for Cogeco News.